And I'd like to introduce Anna to you.
Anna, come on in. Hi, can I ask you a few questions?
Yes, that's okay.
I usually start with some simple things like, are you allergic to anything?
No, nothing.
Terrific. And are you married or single?
I'm married.
Okay. And do you work out of the home at all?
No, I stay at home.
Okay. And how long have you been in Australia?
It is 22 years now. I was 28 when I came out.
Oh, wow. And you came from?
Iran.
How old are you?
I'm 50.
How many kids?
I have none, no children.
What brings you to me today?
I think maybe I'm coming to menopause.
Okay.
Because my cycle, it's becoming much longer and there's a lot more heavy bleeding coming.
Anything else?
Well, the last couple of weeks, I noticed that the bleeding, it's happened after, well, my husband and I.
After intercourse?
Yes.
Your period started when you were about how old?
I was 12.
Okay. And they were regular
Yes.
and not too much of a problem?
No, not a problem.
Cramping?
A little bit, not a huge amount.
Cramping been worse recently?
Yes.
How long do you think? 5 years, 2 years?
I think maybe 1 year, and it's just much more blood.
What we probably need to do is check what's happening with this heavy bleeding.
Mm-hmm. It's not menopause, or?
Well, it might be, but not everybody gets this sort of heavy flooding with their menopause. Mm-hmm. It doesn't sound like you're anemic, but it does sound like there could be something not quite right in your pelvis.
You think I have cancer?
Look, I don't really think so, but there's checks that we need to make.
What is the check?
We make sure that it's okay with you, but then we need to have a look inside your vagina at the tip of the uterus. What we know is if we look at the tip of the cervix, we can see whether there's a problem with it if it's starting to change.
How would I get problem there, though?
It only happens in women who've been sexually active.
But I'm not sexually active.
Didn't we just say that you were having sex with your husband?
Yes, just my husband.
That's called sexually active.
But I'm not with anybody else.
It doesn't necessarily mean that you've been with anybody else.
So you get this disease from having sex?
One of the diseases you can get, one of the cancers you can get on your uterus, that's a cancer just on the tip, can come from an infection that's sexually related or sexually transmitted.
But how I catch it? I only ever be with my husband.
Exactly, but not that I think there's necessarily a cancer here, okay?
I come from being sexually active. The only person I am with is my husband from when I was married as a teenager. And
absolutely.
Does he give this to me?
Do you think there's something going on with your husband?
I don't know. I didn't think that until now.
Thank you very much indeed. Thank you.
Sorry.